before. So do you think your suggestion is really what can solve the issue? Then, Dr. Michi, you said we must get it right. What are we getting right? Thank you. So we take the round of questions and then the responses of so main number 2. Introduce yourself, your medium, and direct your question.
Okay, thank you very much. My name is Iman Douglas for Wasoka. And my question is Chito Nelson. It is no longer news to say that an improved nutrition leads to an improved society. It brings about national development and all that. And you made mention of the fact that the former president signed or gave a directive after signing this law that nutrition department should establish in agencies and all that. And the vice president in the administration also took over from there and gave this directive through the Ministry of Budget, which it was sent to different agencies and all that. And yet, so many agencies are yet to obey this presidential directive. There are countries that whenever there's a presidential directive, it's just like a law. And if not implemented, there are consequences. Thank you. There are consequences. Again, what the president at that time, set up a monitoring and evaluation committee to ensure the implementation of that policy and all that. What are the consequences of you just give a presidential directive and just allow it like that so people will do anything they want to do? Because this is something that will improve his government. So what are the consequences for not implementing this and who is to take the blame? Thank you.
Yourself, your medium. A very good afternoon, everyone. Please appreciate my already established protocol. Nkiri Molio KK is my name. I work with Capital of Radio Nigeria. And I'm also the second of key factors in driving this course and getting the desired change we want to see. We're talking about moving driving the course of this establishment, talking about nutrition. We can't continue doing the same old things and expect to see new things. We must sound the music plan, let it be a top priority in most of the media, and that's why now is here. Because this are receiving women and children. Talking about the Benue State, Borno, Adamawa, and Yobe States. As of last year, August 2023, action. We must be intentional with our advocacy tools. We must be deliberate, intentional, proactive steps. Time is gone. We can't continue coming here drinking tea, then we can go with the source and come back to the we need to do this. Hold people accountable. Let the media preach this. Let them know who are we. We only let you get the attention we want to see. Getting it just a change. I have my clients, I've seen a lot of them online in my colleagues, but we need our rights, channels we have them. It should be at the center. Let this be loud enough for us to get the desired change. I know people are counted. We are 36 states, including FCT, only 7 states, talking about the implementation. One of the problems we have in this country is not policy, it's not even no. It's implementation. Somebody made mention of political will. Those that don't want to do that's the time we come in. The media, we are 36 states, including that's language. We need to say, stop portraying the shadows that are living the sufferings. The time is out. I must commend the CS-SUNN for holding up for you who have doing pretty well over the years, but my own stand and submission this afternoon, we can continue to be doing the simple things and we want to see new results. The time is out for us for collective effort. We don't work in silence. Collective effort for us to see a very proactive and get the desires of we want to see. Thank you very much. Question.
find out a very vital information. You can say that some departments are dragging their feet in implementing the directive of federal government. Can we know how many of these ministries have kind of used to take this direction so that we can be very specific in our report. We need to know how many of these ministries have attended the directive, which ones have not. And then when it comes to states, we need also to know how many states, if it means naming the states, we name them at this stage so that our information is very good. I think it's very simple. I think people have that directive and they are not obeying. Let's know the people that are not obeying so we can do that. And my other question is in terms of budgetary needs, have we assessed what it will take to carry on this matter? An estimate over the years, how much have we put into it at the private company level? And what are we looking at of projection? Are we expected to make to be able to the institutional needs at this moment? Thank you.
Thank you. Thank you so very much. Please take this over. So, I don't know, maybe we'll take some of the responses and then we go again. It's your kind permission. Okay. So that questions.
Yes, thank you very much for your question. Yes, the issue you mentioned, yes, can be addressed through my suggestion. First of all, I said that 22%, that's over 40, that's 4. If we use 200 million population, that's about 44 million have severe food insecurity, that is, are likely to miss food for 1 day, And just like I said, there are several issues that are attached to that because when that continues for a long time, it's going to lead to very serious malnutrition for those individuals. Their children will not be able to handle school. The following week, everybody can also drop out of school. And when you look at the status of all these problems, you can see why no Nigeria is rich. There is also addressed as the poverty equator of the world. Because that is the understanding that people will not have. And my suggestion is that when those departments are created, each of those departments they address their own market so that the type of crops that we are going to be producing or labor emphasis are the ones that are going to be beneficial in terms of nutritional benefit to our people. And then also ensure that looking at the report of that address of the micronutrients that are lacking or the kind of nutrients that are lacking in the large proportion of our population are the ones that are going to be addressed. Okay, from the national to the grassroots. That's the mandate of our. Okay? Now, for education, why is it that in the rural areas where foods are produced, you have the highest level, the highest number of people that are not there, even though they have the food? So this is where education comes in. So the Ministry of Education and National Orientation will also do their own mandate. Educate children at the various levels of the educational sector, right? Even informal, non-formal education for adult non-formal education, you educate people
on what the right kind of food to consume, to combine. Not everything that you get that you go and sell off. Most times when you are passing through community when you are traveling, you see the choices of fruits. Let this place for sale. The choices of their produce. How many of those things are you also consuming? Why is it that the pot that produces the food is the one that is also working? These are the issues we need to start addressing. Okay, look at humanitarian affairs. We know that in every country, there is usually the poorest of the poor. People are not going to help themselves. That is why social ministry, there's what we call social safety net. Because every citizen of the country, in fact, the goal of the policy of the food and nutrition policy of the Ghana is to ensure that every citizen has adequate nutrition. Given that goal, we know some people cannot help themselves. So there is a ministry that has been created to assist so that those people are not left out of nutrition. So whatever Rwanda is doing, that's all. So you can see the relevance of each of these sectors that we are talking about. The youth and children, through several means, which is the alignment of their ministry. But then when we have a notion department, it's going to ensure that they look at the overall programs and policies of
the WDC say, yes, we did this together, we planned this together, and we achieved together. We must get it right. Some people are working in the nutrition space. Some are called nutrition officers, those that rose through the rank. Some are nutritionists, those that have gone to higher level to study nutrition. There's something they call career progression. So nutrition officers, nutritionists should be given opportunity to get to their career progression, to thrive in the nutrition space. Tomorrow I may retire, so it's not being selfish. Or if I don't even get to that journey that I retire and if I decide to leave tomorrow for other things, I will always say this. I will continue to say this. In a pharmaceutical company or in a pharmaceutical department, pharmacist or pharmacy technician, they lead. You're working with other people. Yes, you need to work with other people. Not everything can do this alone. But there must be a leader. That is what I'm saying. Not that all ladies is selfish. There must be a leader. In a law court, you have doctors that are police officers. You have pharmacists there. But somebody is the leader. They were. You get to the theater, you have different professions there. But the surgeon is the one that will, let me use the word, that will use the knife, so to speak. So in the nutrition department, the name is nutrition. Yes, we tackle nutrition in a multi-sectoral, multi-stakeholder, multidisciplinary approach. That is true. But someone should lead it. That is my stand. And it will always be my stand. Even if I retire tomorrow, even if I decide to leave the service tomorrow, that will always be my stand. Thank you.
Thank you so very much. So while we're walking to shipping, I just wanted to throw in the question from this day. It was for you. Yes, and you stepped out. You wanted to know how many MDs in Nigeria, they have set up nutrition departments and how many states that are running with this. And the other question is that he wanted to understand the potential projection that will enable Nigeria address the burden of malnutrition in terms of monetary costs. What should we be expending to eradicate malnutrition from Nigeria? And I wanted to appeal to the table who can find a way of making our responses more concise so that we can go within our time. So, we take some comments and then. Yeah.
Then somebody was asking about who should be blamed for the presidential directive not to be implemented and the consequences. The consequences are that all the advantages we've seen having the education department to without it will not be there. And who is to blame? I would say it's the system. It's the system that should be blamed, because if not for the system, the president will give a directive. It's just like an executive order, and we are coming with it. So it's a systemic thing, and I can't apportion blame to anybody, but the right thing should be done. And based on what my sister Ogechi is hammering on, yes, the cadre has been developed from tuition, and people have gone to school. Rest, they not getting to your full potential is also a systemic failure, because you have your PhD. It's a man that suffered the same thing. I suffered the same thing because it's a system, and there must be an end to it. Nutrition, people that went to school to study nutrition should get to the highest level of their career, and we continue to advocate for it. It's not only she's talking about it, but while we raise the issue, nutrition department, we engage nutritionists to work, because we have 1,000. I heard Calabar graduate up to 400 a year. All universities, we have a lot. We need to employ nutritionists, because we did not go to school to read the back of the book. We did not read the back. We read the front. And after suffering, you are pushed down, you are there, somebody is brought up. That is what we want a change to happen in that line. It's a systemic failure too. So things around Nigeria, and we are believing that things will improve. On the departments, on the ministry that established nutrition department, we only have health, we have agri. I must say that MPSC has established nutrition department, because when we establish the nutrition department, the expectation is that you write to the Ministry of Work and Economic Planning, and we know that things are happening. But MPSC here, I don't know whether I will say it's a kangaroo nutrition department, because we are not seeing anything happening in that department. So for now, it's only health and agri, technological innovation. They have not. Women affairs, they have not. Education, they have not. Water resources, they have not. Information and national orientation, they have not. Education, they have not. Humanitarian, they have not. And national state, and number state they have. Please be sure. Verify with before you go do the publications around this institutional department. So on how much we did actually to fund the plan. The total plan was estimated to cost 294 billion for 5 years, and it's supposed to be what is to be utilized at the federal level, at the state level, and at the subnational level. It's a national thing. But unfortunately, for the going to the fourth year of the implementation, we've not implemented up to 20% of what is in that plan. We have not got to. And from estimation, it will be costing us around $400 million to implement that project. Thank you, Another.
Thank you. Insightful, very valuable comments, responses coming from the case. Okay.
Thank you, man, for because the question was put for me.
of the government. I just want to, on the issue of implementation, I mentioned something during my own, that NCA can play serious role is to ensure through the office of the vice president and God is representative to make sure that every meeting of NCA, you put it on the agenda on the issue of the creation of the nutrition department. It should be there on the agenda, and part of the emphasis is the benefits that are good to those department that have ministry that have, they can have 1 or 2 slides on what is going on there, and also on the challenges. They should now, after that presentation on what is happening in those places, they should make all the other MDAs, the nutrition MDAs, to present to the council why they are not. So by that, it's more or less an MIE on its own on what is happening. And since it's at the highest level, their ministers are also there. Because these things we are saying, the minister may not even be aware. They will not even bring it to the notice of the minister. So these are issues that we need to then doing the same thing and get results. The issue of the media. I know before the last election, one significant thing took place, that the nutrition community now have a kind of media engagement at Abuja and also in Lagos. And you realize just short time after that, a lot of nutrition issues were coming up on the different media houses, discussing on nutrition. People you could see during that meeting that many of the media people are seriously ignorant on the issue of nutrition. So it's very important to continue such efforts. And like I mentioned, it's intentional thing. It's not something we do. We just do it during election. Even if it's something we engage them on a quarterly basis, it's worthwhile. It is very important. Then finally, it's on the what happened at Ebonyi State. I had the opportunity of, there was a sensitization meeting, or is this sensitization? They took all the nutrition development engagement. They become many actions to influence. And every doubt they have in their mind, in the course of that engagement, we make that atmosphere very free, that they can express what is in their mind. And people are also there to be able to address those issues. You will also see that there will be some changes. It may not be all, but significantly, you will see a lot of changes that will occur. Thank you.
I want to react to the comments from the NAWOD secretary. Yes, about stations like Arise and the rest of them not being here. And why we should do the same thing over and over. I think it's part of the advocacy thing we're talking about. You don't do it just once and you stop. And I'm sure that all these radio houses were invited. Maybe they have reasons why they are not here. But we are glad that we have NAWOD here and other media houses who can also help to educate your colleagues. And the advocacy that we're talking about, we can carry also CS-SUNN and co can carry advocacy to the media houses as well. We have done it in the past, and which is what CS-SUNN now enjoys with the media. So we can do that. Advocacy also to the heads of the media houses, yes, so that they understand what this is all about and buy into. So that is what I think.
Thank you. Okay, so the CS-SUNN PM would also want to react to.
Let me hold my. I think. Thank you very much for the comments. I really have to appeal to the House, both the panelists and the audience, and the sacrifices that you have all made to still stay here. Honestly, I look at the contingent on this table, and I know it's a huge sacrifice from Dr. Motala, Mommy Nelson, Dr. Sholake, our president, Mrs. Aji, MNI, Dr. Gechi, Mama Nutrition, Professor Nico. In fact, I am feeling good to all over my body to tell you how important this issue is. You know, it's not easy to get them seated like this for about 3 hours now. It's not easy. We really appreciate the sacrifice. We very much appreciate. So I want to beg us, and even the press, it's interesting, nobody is sleeping. If the issue is not, if you're not passionate about it, people would have been sleeping by now. But you can see that we are all awake, trying to push. So please, I just want to beg us to see how we summarize so that we can also release them. And we can also all go and face the days. I never need to take up to 3 hours. Ask her. We plan to have lunch by 12:30. But this shows that we all have this burning interest in our hearts. So, to what Nawaj said, we made efforts we invited, ITD was here in the morning, NTA was invited, Arise was invited, AIT has been here. We always do our best. But remember, CS-SUNN is a civil society alliance, and we don't have big budgets like UNICEF, World Bank, and all those. We don't have. So we try to. That is why we always appreciate the sacrifices of, and they keep pushing out information. But you have just given us an open invitation. Your secretary is here, the chairman, the vice chairman is here. So we will also have more talks with you to leverage on your network across the states. So, but you still have to, work with us the way at almost nothing. We have to work together to measure their attention, and they have to. So please, let's just round off so that people can.
Okay, thank you so very much, Peter. Thank you. We are taking our advocacies to channels, Arise, to prioritize the vision of reportage at little or no cost. We are famished. So I think with all the questions, we've gotten all we need to do our reports. So we'll move to the presentation of the press statements. We want to invite the co-chair of the Civil Society Scale of Nutrition in Nigeria, Mrs. Aji Robinson, to present the press statement. It's a joint signed press statement for the Civil Society Scale of Nutrition in Nigeria in collaboration with the Nutrition Society of Nigeria. Please grant attention.
Thank you so much. On behalf of the executive secretary and producers, but I want to recognize the board of trustees of Civil Society Scale Nutrition in Nigeria, some CSS Nigeria. I want to recognize of NSN Cycling. I want to recognize our partners and the ministries, MDAs, already ministries and MDAs here. Protocols that have been established, I stand on it right now. So I will read the statements. The press statement issued by the Civil Society Scale of Nutrition in Nigeria, CS-SUNN, and the Nutrition Society of Nigeria on the national emergency on food and nutrition situation in the country on the 27th May during the media roundtable in Nigeria. Esteemed members of the press, distinguished stakeholders, and honored guests, nutrition is the cornerstone of health and development. It It is linked to improved infant, child, and maternal health, stronger immune system, safer pregnancies, and childbirth, lower risk of non-communicable diseases such as diabetes and cardiovascular diseases, and increased longevity. It is fundamental to the growth and development of children and adolescents, the productivity of adults, and the overall economic advancement of a nation. Malnutrition is a multifaceted problem that requires the involvement of all government sectors. A multi-sectoral approach with central coordination is essential to addressing the complex nature of malnutrition. It is important for each sector to implement programs according to its mandate in line with the National Policy of Food and Nutrition and the multi-sectoral plan of action for its implementation. Food insecurity and malnutrition remains a major concern in Nigeria currently. In 26.5 million Nigerians are projected to be food insecure in 2024. The conflict affected Borno, Adamawa, and Yobe, now called Bay, states are the worst hit, according to the 2024 March CADA harmonized analysis. And as estimated, 4.8 million people are at risk of severe hunger during this year's lean season in the Bay states alone. With the lean season almost here, food inflation on the rise, and the general insecurity, farmers feel insecure to go to their farms. Coupled with the adverse effects must be on them to address this ugly situation. The civil society scaled up nutrition in Nigeria and the Nutrition Society of Nigeria commend the federal government of Nigeria's response to addressing the challenges of food and nutrition insecurity in the country. The federal government has in the past endorsed the National Policy on Food and Nutrition in 2016 and the National Multi-Sectoral Plan of Action on Food and Nutrition, that is the NS-SUNN, in 2021 and other rigorous policies and guidelines. The issued directive on the establishment of nutrition departments within relevant ministries to ensure cohesive policy implementation and improve resource allocation for nutrition interventions. Issued directive for the creation of budget line for nutrition to ensure availability of funds for the implementation of the National Multi-Sectoral Plan of Action for Food and Nutrition, which annual estimate cost of implementation is about $100 million. Regrettably, the challenges of food and nutrition has continued unabated. We are therefore using this opportunity to call on the President of the Federal Republic of Nigeria, His Excellency, Senator Bola Ahmed Tinubu, GCFR, to mandate the National Council on Nutrition, reiterated by the Vice President, His Excellency Senator Kashim Shettima, GCON, to bring together relevant MDAs and subnational government to urgently respond to the crisis with appropriate short-term, long-term measures and put in place relevant government structures for planning, monitoring, and oversight. Direct the National Council on Nutrition, which is the highest decision-making body on food and nutrition in the country, to properly address the challenges of food and nutrition insecurity in the country, as it is obtainable in other development countries like Nigeria, where a lot of progress has been made in improving nutrition indices. Direct the National Council on Nutrition to strengthen nutrition governance at all levels, from the federal to the sub-national levels, including the implementation of the presidential directives on setting up of nutrition departments in all relevant ministries, departments, and agencies in the country. Support nutrition financing initiative and direct the setting up of a nutrition investment trust fund. Support nutrition, sustain emergency food assistance, health and protection assistance to those in most critical need, particularly during the lean season, including new arrivals from hard-to-reach areas, IDPs in camps, and affected host communities. We, that is civil society, scaling of nutrition and nutrition society, nutrition society of Nigeria, we believe that taking these measures and urgently position the country in the right track to ending food insecurity and malnutrition in Nigeria. Thank you very much for your attention. Thank you.
Thank you so very much. Thank you. So at this point, we've come to the end of this media roundtable. Before we proceed for lunch and having the photograph out at the waiting area, we want to invite the President of the Nutrition Society of Nigeria to please give us the closing remark. Thank you, sir.
Distinguished members at this side of the table, highly esteemed journalists and media representatives that are here. The program is very, very exciting and very, very interactive. We have actually interacted to lay out the problems and then ways by which we can address them. I recognize the media team and I want to appreciate their patience, their genuine commitment. The various questions that have been asked, those that I believe will go a long way. So I inform what is going to be coming out from your outlets that can get to the ears of political leaders as well as our bureaucrats who are in charge of the implementation of programs and activities of the government, so that they can have a change of strategies and do what is needed to ensure that Nigeria will move forward, make progress in terms of reduction of malnutrition, and so that that can actually be pathway to achieving the sustainable development goals. On that note, I want to seize this opportunity on behalf of the Secretary of CS-SUNN and myself and all the team that are here. I want to declare this event closed. Thank you very much.
Thank you, sir. Thank you. So lunch is served. We have the group photograph outside by the reception area. We proceed to lunch. Just message nations, I think.
Yes.